Hello, this is a quick one for my mummies and particularly my pregnant mummies. I want us to talk about um, scans that you do during your pregnancy, also known as obstetric scans or the obstetric ultrasound. And it's such a beautiful moment when you get to do your scan and hear your baby, see them move, hear their heartbeat, and it's such an intimate moment. And there are mothers who are able to do it every single month just when they feel like seeing their baby. But an obstetric scan is actually a very important scan to monitor your baby's growth beyond just those lovely fuzzy moments of hearing their heartbeat. And I want to highlight when to do those scans. The three most important obstetric scans or pregnancy scans to do during your pregnancy. And there are three, and it's very easy to remember because you have 3 trimesters in pregnancy. And so each one is in each trimester of the pregnancy. So your first trimester ultrasound scan is usually done between 6 to 12 weeks. And it's important because the first thing we need to do is confirm that there is a pregnancy and there's a heartbeat. So we want to hear the baby's heartbeat. Secondly, we want to see that the pregnancy is inside the uterus and not anywhere else. When the pregnancy is outside of the uterus, we call that an ectopic pregnancy. And most commonly, that's in the fallopian tubes, but there are also those who have abdominal pregnancies. Either way, we don't want pregnancies there because they can be harmful and need to be addressed. So the first thing is to confirm that this pregnancy test that was positive is for a pregnancy that is inside the uterus. Then the other thing we do is want to know how many babies you have. Because if you have 2 babies, 3 babies, you need to start planning financially, right? And prepare the family that it's not just 1, but it's 2 or 3, And so that's also pretty important. And finally, in the first trimester scan, we also want to determine the estimated due date. The first trimester is the most accurate of all the scans that you'll do to identify, to estimate the date of delivery. Especially if you had an irregular period or are unsure about your dates in terms of the calendar, the ultrasound in the first trimester will give you the most accurate dates. Normally thereafter, from second to third trimester, the dates could be off like even 1 to 2 weeks off, right? And so the first trimester is very important for that. Then we have the second trimester scan, and particularly during between 18 to 22 weeks. And what we're doing here is an anomaly scan. The anomaly scan is basically looking at your baby's organs. By this time, your baby's organs are fully developed. They have a brain, they have eyes, they have their heart, they have their spine and their limbs. Everything is formed. And so a detailed assessment is done for all those organs to look at the heart and see, are there 4 chambers? Everything, is the blood flowing as it should? And that's very important. We want to check that the baby's organs are well and there are no abnormalities. And if there are, it just helps us plan on what we need to do, whether in utero while the baby is still in your uterus, or now what to do once they're delivered. The other thing is the gender reveal. And for parents who want to be surprised, you need to go there shouting very loudly to your sonographer that we do not want to know the gender of the baby, because as they're there saying, and the kidneys, and wow, we have our testes, and you're like, no, I don't want to know. So it's very important that you give your sonographer a heads up if you want to be surprised, because during this second trimester scan and the anomaly scan, they can, not always, because it depends on the position of the baby, they can identify the gender of your baby. And then also now from the mother's side, we want to see the placenta, the health of the placenta. And so the general health is how the blood is flowing and if it's generally looking healthy, and also where it's positioned. If it's low-lying, like very close to the cervix or the opening of your uterus, that may be a cause for bleeding during pregnancy. Also, that there are some placentas that even just start to bleed, and you can see, we call them subchorionic bleeds, and so that needs to be checked. and addressed. And it's not necessarily always a reason for concern, but it's just good to know so that we can plan. Then there's a third trimester scan. The third trimester scan is usually between 28 to 36 weeks, and normally a biophysical profile is done. And what that basically means is now that your baby is just growing. After the second trimester, now your baby is just gaining weight, it's just growing. All the organs are formed and it's just about growth. And so it's just monitoring that the baby's growth is as expected, meaning that their weight is in line with how old the baby is, the gestational age, right? We also get to know an estimated weight at the time of delivery. Like we can see, okay, this is going to be a big baby or this is going to be a smaller baby, and can also help the doctor delivering you plan on the mode of delivery. So if you're like a petite mom and your baby is quite big and they check like, we don't know if a vaginal delivery will be easy, they'll probably still try, but you just want to panga, you want to always plan like, hii kichwa na hii njia, can it work? Yeah. The other thing is amniotic fluid level. So amniotic fluid is that water, that maji in your belly. And it's just to understand there's a normal range you expect the fluids to be. So we don't want it to be too low, meaning there's a leak, or too much, meaning, again, some other challenges. And so it's just to assess. It's an indicator of the baby's health and your health as a mom. Again, we look at the placenta. I won't go into the details of the placenta, but it's just the health. Is there any bleeding? Where is the placenta in the uterus? Are we good to go? The other thing we look for is the blood flow in the cord. Is blood flowing nicely between the mother, the placenta, and the baby? Because that helps us know about the baby's health and how they're developing, and how they're progressing in the uterus. And then last but not least is the baby's position. It's more of just to confirm, because normally when your doctor holds you and does that physical exam, they'll be able to tell, the head is down or engaged, or the head is now up, meaning it's breech. And so again, all those are important factors in terms of determining how you're going to deliver. So those are the 3 scans. First trimester, most importantly, to confirm the pregnancy is inside the uterus and is viable, and the dates. Second trimester scan, the anomaly scan, to just do a detailed assessment of the body's organs, the gender reveal, and check if there are any placental issues. Then the third trimester scan, which is the biophysical profile, basically looks at the baby's growth and also helps the doctor determine the mode or the way you're going to deliver, whether it's going to be a C-section or a normal delivery. Okay? So those are the 3 scans that we recommend that you should do. And I hope you have a lovely pregnancy.